really important.
And I think if we go to the next slide, I'm turning it back over to you.
Well, that's, yeah. Yeah. So that was a lot of information. That was like all of your options that Jesse just went over in a very short amount of time. So, if you've got questions, please put them in the chat and we'll try and get to them as we go along. I'm going to just switch gears here a little bit and talk about health insurance options for employers who want to offer something, health or dental insurance, to their employees. And again, I'm going to go back to the beginning where I kind of talked about the idea that, many employees are looking for benefits, right? So this slide kind of provides a little bit of an overview. So as an employer, you can sponsor health insurance for your employees. And you can do that by getting a group coverage, right? A group health insurance plan that could be purchased through a health insurance provider, right? Like Blue Cross Blue Shield or Aetna, or by working with a broker dealer. You could also offer it or purchase insurance through what is called the Health Insurance Marketplace, which Jesse mentioned before as a tool for individuals and families, but they have a special a program for small business owners, and you need to have one or more employees. It is called the Shop. Another alternative is not so much to offer health insurance, but to offer a health reimbursement account. And I'm going to talk a little bit about that. And then some employers just add more to the wages to help offset some of that cost. The downside to that, because I'm not going to spend a lot of time on that option, but the downside is you can't force them to spend that money on healthcare, right? It's their wages, it would go into their paycheck, and then you don't know where they're going to use that money. So really some of these other options are better options. So let's talk about health insurance marketplace coverage for yourself and employees. So under the Affordable Care Act, right, there is this health insurance marketplace that we've mentioned before, and they have what are called shop plans. And these plans are negotiated by the state insurance commission's office with the health insurance provider, and they kind of determine how many plans are offered and by which companies, meaning, is it Aetna and, say United Concordia or Blue Cross Blue Shield. So the state negotiates this. And then you can go onto that healthcare.gov, pick your state. And then when you do that, usually it comes to a page where it says, are you shopping for individuals and families, or are you shopping as an employer? And you would click on the employer one, and then you could see the plans that are available. It's pretty user-friendly. I have to say, I've spent some time in the website. So in addition to that, there are brokers and dealers who have been trained through the Healthcare Marketplace Initiative to be able to sit down and talk with you and help you figure out, well, which plan might work better for you as an employer. So why would you think about doing something like this? Well, there are some tax credits that are offered through the IRS to small businesses who choose a healthcare marketplace plan. And those tax credits can cover a good amount of the costs of you as the employer who's covering costs. So typically, right, you're going to pay something for this plan for your employees, and your employees are going to pay a premium as well. And so the piece that the tax credits cover is the cost that you might pay to help cover your employees. Most of the time, there are several different plans that you can choose from, so you can comparison shop. Also, there is some flexibility in contributing to your employees' premiums. So you can choose, well, I'm going to pay, I'll just say 40% of the cost, or you can say, I'm going to pay $100 towards the cost, right? So there's a fixed percentage or a fixed amount, right? That you can offset the cost for your employees. Now, of course, that stuff, anything that you contribute to your employees' health insurance coverage is tax deductible, right? So, so think of it that way. It's reducing your overall income. Let's see, what else? Employers can offer only healthcare coverage or dental or both. So it gives you that option. You can choose how much to pay towards your employees' premiums and whether to offer coverage to their dependents. And then you can also determine like how long do new employees have to wait before enrolling in a health insurance plan. So it gives you a lot of flexibility, and the benefit really is the tax credit, right? Because it'll help reduce your overall costs. All right, so health insurance marketplace for coverage for self and employees. So things that you want to think about, right? Your business needs to be located in the state where you're applying for coverage. So, especially in Delaware, Maryland, we oftentimes have, businesses in Delaware, but they live in Maryland. So you would have to, as a business owner, apply for Delaware coverage because the business is in Delaware. So that's something to consider, because if you live in one state but go have service providers in another state, you want to be sure that the insurance you're purchasing is going to cover the healthcare providers that you want to go to, right? And that's about the network. And so that's something to pay attention to. If you employ 50 or fewer full-time equivalent employees, you would be eligible a marketplace shop plan, but you have to have at least one employee. And coverage has to be available to all full-time employees. So that's something to think about too. You can't just say, oh, I'm going to cover these 3, but not those 4, right? And to qualify for those tax credits, you have to pay 50% of the employee's medical premium costs. So what does that mean? So let's say the premium is $300 a person. You as the employer would cover 150 and your employee would cover 150. So you would have to cover half of those premium costs. It's a lot to think about and some calculations to work through. So here are some really great resources. The healthcare.gov, small businesses get coverage, provides some really great information that can help you kind of sort through and understand the plans a little bit. And then this other website is some resources that is offered through the medical and Medicare services department through the government. Okay, so what about covering self and employees through independent agents and brokers? So as Jesse said, you can work with a broker or an agent. So what's the difference? An agent is going to be a representative from one company. So like in his example, he said State Farm. So an agent would only sell State Farm insurance. as opposed to a broker who is going to be representing several companies, can maybe help you do some comparison shopping. But anyway, they could help you kind of sort through what different options there are, what different plans there are. And of course, you do want to shop around and get the best prices and the best coverage. All right. So I'm going to switch gears from actually offering insurance to offering what is called a health reimbursement account, or an HRA. And so this is an IRS tax approved advantaged health benefit plan that is available to you as an employer to offer to your employees. And what it does is it's a benefit that encourages employees to purchase their own health insurance, but what you're doing is helping to offset some of those costs. And so there's a special account then that's set up that you as the employer would say, all right, I'm willing to contribute, I'm just going to make up a number, $1,000 towards your healthcare costs as an employee. And so that employee would then go out and get their own health insurance. But as they have expenses, they would turn them into you as the employer, and you would reimburse them for those expenses. So those expenses might be a premium, it may be a co-payment, it may be a deductible, deductible that they have to cover because of the insurance program that they've purchased. So, and then once they have exhausted that, in my example, $1,000, you're done, right? But it can be used for any kind of expenses. And the contributions are tax deductible by you, the employer. And what is also nice is it is not considered wages to the employee. So it does not change their taxable amount of income. And the downside is there are some rules about who can be covered by an HRA. And usually you're going to have to offer it to everybody. But some of that has to do with, well, is that person full-time or part-time and whatnot. But most of the time it has to do with kind of the position of the person. So if you have a bunch of managers, all of those managers would have to be covered, for example. But someone who's coming in part-time, maybe 10 hours a week, because they're a different, I'll just say, level of employee, they may not have to be covered, right? So some tax rules that you need to think about, but for the most part, a really great option for people who want to help offset healthcare costs for an employee. So things to really know and understand, an HRA isn't healthcare coverage, it's just an ability to help someone cover healthcare costs. And the other piece is you can't offer a health reimbursement account for someone who doesn't have a health insurance plan. So there is going to have to be some documentation where an employee will show you that they are actually covered by health insurance. So obviously you want to understand all this before you set up health reimbursement program, and you really do need to treat everybody equally. Of course, CMS and healthcare.gov all have some really great resources that can help you sort through all of this and learn more, as well as those kind of insurance agents and brokers. And of course, the IRS has a publication. This is a really great publication. It's pretty easy to understand. And it helps you kind of understand the rules around what's tax deductible, who needs to be covered, all of the things that I just reviewed. So one of the things we wanted to share with you is our health insurance literacy team has this wonderful My Smart Choice Health Insurance Workbook. It's in its 7th edition. It has been well received for the last 12 years since the Affordable Care Act got passed. And I'm sure Jesse's gonna put the link in the chat. But it's a really great workbook to have you kind of go through and figure out, comparison shop across plans, some things to think through as you consider health insurance choice options. And so this is where I get to say, what questions do you have? And I don't know whether Jesse has been monitoring the chat and can help us kind of process these questions, but we are happy to answer your questions at this point. And that's our contact information if you need us. And I think that's it in terms of our slides. Oh, yes. Okay.